Okay, so for the next organism which we look at is the Clostridium what? Botulinum. Clostridium botulinum. So you can see this shape I'll actually describe it as a rod shape, right? I'll describe it as kind of like a rod shape, right? So this Clostridium botulinum is what? A gram positive, right? Meaning to maintain or retain that violet stain, that's anti-gram staining, right? So to retain that, it is actually a spore-forming organism. So it forms spores. It's an anaerobic bacteria which is best known for what? Producing potent neurotoxin which is known as what? Botulinum. So being anaerobic, that means it can actually survive in places where there's no air, there's no oxygen, right? So this botulinum neurotoxin can cause what is cause paralytic illnesses. Can basically paralyze your stop the action of nerves, paralyze muscles and all of that. Okay. So what is the classification of this Clostridium? We said that the classification is what? The domain is bacteria, phylum is Bacillota, class is Clostridia, other Clostridiales, family calls Clostridiaceae, genus is Clostridium, then the species is Clostridium what? Botulinum. So what is the description and significance? We said that it's an obligate anaerobe, meaning it can actually thrive in environments that there is no oxygen even. It's rod shaped just like I was telling you guys from these things. Alright. So we said that it is actually resistant to heat or any other adverse conditions. So when it produces spores, the spores can survive in a dormant state until they actually find a suitable environment to now sprout back into life. Right. So it's typically found in low oxygen conditions like those found in improperly canned or preserved foods. So we say that the botulinum toxin produced by this Clostridium botulinum is one of the most potent neurotoxins known. So we say that there are 7 types of the botulinum toxin. Right, so we have botulinum toxin A, B, down to G. So the types of A, B, E, and F, those ones can actually cause diseases in human beings, and it's produced by this Clostridium. So that the toxin actually works by blocking the release of what? Acetylcholine at neuromuscular junctions. And this actually leads to what? Flaccidity, flaccid paralysis, right? So for the types of botulinum, so that foodborne botulinum, this one occurs when people ingest foods that is contained preformed toxin. So for the symptoms, you'll be having difficulties in swallowing because your muscles in the neck will be paralyzed already. Okay, muscle weakness, paralysis. Then infant botulinum is caused by ingesting what? Clostridium spores. Okay, symptoms is same thing: constipation, feeding, poor feeding. Then wound botulinum is when your wound is infected by the infection. Inhalation botulinum is when you actually uh, inhale the toxin in air. So for clinical uses, we say that the botulinum toxin, even as we have spoken about the bad side of it, it has medical applications, right? So if it is given in small doses, it can be used to treat variety of conditions like when somebody has muscle spasm now, so you want to paralyze the person a bit or relax the muscles, you now what? Tip in this botulinum, right? And it's also widely known for its what? Cosmetic use in reducing wrinkles, okay? So for treatment and prevention, that's if you basically have the negative effect of it, which is botulinum toxicity, you might want to administer an antitoxin, right, which may actually basically help you in recovery. Then good food handling and all of that, just to prevent the toxins, all of that, right? So that's it for Clostridium botulinum.